If I could wave a magic wand and change one thing about the coverage, it would be that. It would be to push back on this assumption that just disabled people's lives don't matter as much.
I identify as a Black disabled woman, and I was born with muscular dystrophy, and it impacts not only my mobility, but my respiratory muscles. I've been isolating since mid-February, actually, and I've experienced PCA service interruptions, which is personal care attendant, that service interruption, because they, in fact, tested positive, because their second job is working at a group home. So when that happened, I didn't have my extra set of hands helping me out during the day.
2 elderly disabled family members that I am personally directly responsible for, legally their well-being, are in a nursing home. As of the latest set of data from the federal government, 37,213 people have died in nursing homes. It's about 1/3 of all deaths due to COVID-19 have occurred in these facilities. My grandmother has COVID-19 right now. The other person I'm responsible for doesn't yet. Every day I get this text message every morning around 10 o'clock, and it tells me the number of people who have died in the facility, and it tells me the number of residents who are COVID positive. It tells me the number of staff members who are COVID positive. And there's nothing I can do about it, because we've just made the choice as a country that we're not going to care about these people. We're not going to care about disabled people. We're not going to care about elderly people. We're going to force them into institutions. The inhumanity of our policy decisions that we knew were bad policy decisions is killing people in real time. My medical care has been deferred. I went months, about 4 months. A procedure was delayed. I do it about quarterly. That was really rough. It was just in the last week that I was able to get in there. Any sort of routine medical care has been put on hold. That's a crisis that is affecting obviously more than just me. There's this thing that's been happening since at least March where people will say, well, there have been all these deaths, but they're people with pre-existing or underlying conditions, and so somehow they don't count. As if there aren't literally tens of millions of people in the United States who live with chronic illnesses, who are disabled, as if our lives don't matter somehow because we are at higher risk of dying from COVID-19. That somehow gives our leaders who are failing catastrophically a pass for the deaths they are responsible for. We have seen the development and issuing of what they're calling emergency crisis standards of care, which are the protocols they're going to use to ration scarce healthcare resources if a system becomes overwhelmed because we have abandoned basic public health safety measures, because we've never chosen to implement them in the first place, like a universal masking or PPE requirement. These are deliberate policy choices that our leaders, our elected officials, our policymakers have chosen to make.
A lot of people who are disabled and dealing with different levels of disability already are fraught with terror when we go into hospitals and healthcare settings, because let's face it, they're not the most accessible. You would think they are. You're dealing with inaccessible medical equipment and maybe insensitive medical personnel. So then you go in there and let's suppose you're going in with COVID-related symptoms, and then you're being judged and discriminated on the quality of your life. That's scary. You hear so many stories about so many Black and brown folks being impacted. So if they have a disability, again, it goes back to what is considered quality of your life. And so many people who have disabilities, we have a lot of quality of life. I mean, it may be impacted in different ways, but who's to say that our quality of life is not better than a person who's non-disabled?